Restrictive practices and NDIS PBS. Restrictive practices and NDIS positive behaviour support are connected because both focus on safety, rights and respectful support. Restrictive practices can limit a person's rights or movement. They must follow NDIS rules and safeguards. Positive behaviour support looks at why behaviours happen. A behaviour support plan should explain risks and strategies. The goal is to reduce restrictive practices wherever possible. What are restrictive practices? Restrictive practices are actions that limit a person's choices, rights, or freedom of movement. They may be used only in limited risk situations. They should never be used for punishment or convenience. They may involve medication, equipment, access limits, or physical restraint. Families should ask why a practice is being considered. Every restrictive practice should be clearly explained and reviewed. Regulated restrictive practices under the NDIS. Under the NDIS, regulated restrictive practices are specific practices that must be carefully monitored and reviewed. Chemical restraint, environmental restraint, mechanical restraint, physical restraint, seclusion. These practices can affect dignity and human rights. The aim should be to reduce and eliminate their use over time. Why restrictive practices can be concerning for families? Restrictive practices can feel concerning because they may affect a person's safety, trust, dignity, and emotional well-being. They can limit choice and movement. They may affect how safe a person feels. They can hide the real reason behind behaviour. Families have the right to ask questions. Support should focus on understanding, not control. Dignity and participant rights must stay central. What is NDIS positive behaviour? Support. NDIS positive behaviour. Support helps participants with behaviours of concern receive safer, more respectful support. It may involve a structured behaviour support plan. It focuses on the participant's quality of life. It helps families and providers understand behaviour. It supports safer daily routines. It may help reduce restrictive practices. Before responding to a behaviour, pause and ask, what might this person be trying to communicate? This can help shift the focus from control to understanding. PBS helps reduce restrictive practices. Positive behaviour. Support helps reduce restrictive practices by understanding needs before behaviour escalates. Identify triggers and early warning signs. Improve communication supports. Adjust routines and environments. Reduce sensory stress. Teach safer replacement skills. Support emotional regulation. Give the person more choice and control. Review what is working and what needs to change. Comprehensive Behaviour Support Plan. A comprehensive behaviour support plan provides detailed guidance when support needs are more complex. It may include behaviour assessment information. It explains risks, triggers and support needs. It includes positive behaviour, support strategies. It may include restrictive practice reduction plans. It should be clear and practical. It should be reviewed as needs, goals or circumstances change. What do positive behaviour support practitioners do? Positive behaviour. Support practitioners help understand behaviour and create safer support strategies. They gather information about the participant. They complete behaviour assessments. They identify triggers and support needs. They develop behaviour support plans. They recommend positive strategies. They support families and support teams. They help reduce restrictive practices where possible. What families should be told about restrictive practices? Families should receive clear and respectful information if a restrictive practice is being considered or used. What the restrictive practice is, why it is being considered, what risk it is trying to reduce, what strategies have already been tried, whether it is in a behaviour support plan, how it will be monitored and reviewed, how it will be reduced or stopped. Questions. Families can ask about restrictive practices. Families have the right to ask clear questions about restrictive practices and behaviour support. Why is this practice being considered? What risk is it trying to reduce? What strategies have been tried first? Is it included in the behaviour support plan? Who authorised it? How will it be reviewed? What is the plan to reduce or stop it? How is my loved one's voice included? Restrictive practices should not be used for convenience. Restrictive practices should never be used simply because a situation is difficult to manage. They should not be used for punishment. They should not replace proper support planning. They should not be used for staff convenience. The person's needs should be understood first. Support should focus on safety and dignity. Positive behaviour. Support should look beneath the behavior. Positive behavior. Support for children. Positive behavior support for children should be careful, family-centered, and developmentally appropriate. Children are still building communication and coping skills. Behavior should not be labeled or punished. Support should understand what the child needs. Families should be involved in planning. Strategies may support routines, emotions, and sensory needs. The goal is safety, dignity, and skill development. Positive behavior. Support for adults. Positive behavior support for adults should respect choice, dignity, and independence. Adults should be supported as whole people. Their preferences and goals should be respected. Support may focus on communication and routines. Strategies should reduce restrictive practices. Support should protect rights and quality of life. Risk should be managed without removing dignity. What if you are worried about a restrictive practice? If you are worried about a restrictive practice, you can ask for more information and support. Ask for the behavior support plan. Ask whether the practice is regulated. Ask who authorized it. Ask what strategies have been tried. Ask how it will be reviewed. Speak with the practitioner or provider. Raise serious concerns if safety is at risk. How support teams can help reduce restrictive practices. Reducing restrictive practices usually works best when the whole support team communicates clearly. Understand the behavior support plan. Keep responses consistent. Share updates between services. Identify early signs of distress. Respond before situations escalate. Review what is working. Adjust support as needs change. Keep the participants' goals and rights at the center. How effective care supports. Effective care supports participants with respectful, emotionally centered behavior support, focused on dignity and real-life needs. We focus on the person behind the behavior. We support calm and respectful communication. We work with families and support teams. We connect support with participant goals. We provide practical strategies for daily life. We focus on dignity, rights, and emotional safety. Support should feel human, clear, and connected. Choosing support that protects dignity and safety. Restrictive practices should never replace respectful, person-centered support. NDIS, positive behavior. Support should protect participant rights. It should focus on dignity, communication, and emotional safety. Families can ask for plain language explanations. Behavior, support plans should be clear and practical. Support should help families feel informed and confident. Effective care focuses on care that is human, respectful, and connected to real-life needs.